This is a very relentless disease. It grabs you, and then you sort of get better, and then it comes back, and then you sort of get better, and then it comes back. So I'm in that phase where I'm running fever every night for the last 4 or 5 nights, and it just gets tiring after a while. But fortunately, I haven't had any respiratory trouble, so I'm okay. Symptoms were very mild to start off with. A little bit of cough, headache, runny nose, but nothing beyond that for the first 36 hours. Got a little bit worse with some muscle aches, got tested, it was positive. And by Wednesday, this is now day 5, I thought I was done with it. I felt great. And then suddenly on that Wednesday night, boom, fever, muscle aches, pain everywhere. Just a horrible feeling. But as a doctor, I kind of know what to look for. And I'm monitoring my breathing like a hawk and trying to make sure that that doesn't go south. And knock on wood, I've done well with that so far. He studied pretty well about COVID-19. I knew what it did. The thing about it is that the symptoms are highly variable, and they're different in everyone. And I think what we've learned over the last couple of weeks, just in the U.S. experience, a lot of the dogma that it's only older people, that it doesn't really affect people who are in their 20s, 30s, 40s, and it's okay if they get it, it's no big deal. That is not true. There are lots of 30 and 40-year-olds on respirators right now. And as a 64-year-old, I'm monitoring every day what my symptoms are, but I really think I'm through the woods on this right now. The other point I'd like to make is that the social distancing only goes so far. We really need to all stay at home, and leave the house only when it's essential. That means for food, for medicines. If you're working in an essential business like healthcare or sanitation or police, fire, yes. If you're in the media, that's fine. There's essential stuff that we all have to do. But if it's not essential and you can work from home, stay at home. Minimize your interaction with others.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here, and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.